Be careful. This destroys the health of your pancreas. In this video, I'm going to tell you the 9 most frequent mistakes, the main mistakes that worsen the health of your pancreas, greatly increasing the chance of you becoming diabetic. Or if you are already diabetic, these mistakes increase blood sugar levels, greatly worsening your glycemic control, your diabetes control. So pay close attention and don't commit these mistakes anymore. Don't do that anymore. There are 9. I'm going to start in descending order. Mistake number 9 is not having a routine. If you are taking care of your blood sugar levels and your health, it is essential that you have a routine, that you have a bedtime and a time to wake up, because this way your body can understand how it works. It can understand what part of the day, what time it has to produce a certain hormone, especially the hormone cortisol, which will regulate our circadian cycle. So your body needs to understand that. What is the function of cortisol? Cortisol is known as the stress hormone, but it's fundamental to our lives. Cortisol is not bad. On the contrary, cortisol is essential for life. If you didn't have cortisol, you wouldn't be able to be watching this video, because it's fundamental to our lives. The problem is the excess of cortisol, or when it's produced in the wrong way, like at the wrong time, for example. If you go to sleep and wake up at the same time, your body can regulate this most of the time. Oh, but if I have a party, an event, or a graduation, I won't be able to go because of the bedtime and wake-up time. Of course you will. What I'm saying here is that most days you need to have this schedule, but you can make exceptions so you don't miss out on having a social life as well, like going to an event you'd like to go to, but without going to extremes. It's very important that you understand this. Most of the time you should, but once or twice, it's okay. I am against this kind of conduct. Oh, I can never do such a thing because of diabetes or health. Of course, if there's a graduation, you won't miss it, okay? So we're going to have good control, but we're also going to be able to get on with life in the best way. Mistake number 8 is believing in false promises. Using some supplement or tea, believing that only this can control your diabetes or prevent you from developing diabetes. There are some substances like cinnamon, for instance, that have some studies demonstrating potential benefits. I'm not against this kind of substance, but the vast majority doesn't work. It's just a deception. That's the truth. So, the mistake is to take some supplement or tea without the approval of a doctor or nutritionist. If you want to take something, at least ask if there's any scientific evidence, if it can or can't harm you, because the vast majority can not only harm your pancreas, but your liver as well. It can increase some toxic substances in your body. Always ask your doctor or nutritionist if you can use a certain type of supplement or tea you saw online. Most of the time, I tell patients no, it's harmful. They push the idea of having a supplement because it's appealing, I understand, but it doesn't exist. There's no miracle substance, don't believe that. It's not just about money. Besides losing money, you'll also lose your health. You'll harm your pancreas most of the time. Number 7 is not to eat salad or vegetables. There are several videos that state that vegetables, salads, and leafy greens, for example, don't aid your pancreas health, don't prevent diabetes, or don't improve blood sugar levels, which is a big lie. Salads, leafy greens, and fiber are essential for your health, not just for nutrients like copper and magnesium, which are also studied in pancreatic health, but also with other nutrients. Why? It will also slow down the absorption of food, lowering the glycemic index. What is the glycemic index? It's how much that food, that meal, will increase your blood sugar. If you eat salad, not only will you feel more full, it'll also improve digestion due to the fiber. You'll get the benefit of the nutrients too. So don't fall for the idea that salads don't help. It's a big mistake, because you can't just eat meat, eggs, and cheese. That's not feasible. The vast majority of people at least won't be able to. There's no use in eating only meat 3 or 4 times a day and then being malnourished and having various nutritional deficiencies. It's not good business. Don't believe in these super restrictive diets that avoid everything. Ah, but I heard some vegetables have starch. And starch, once it's digested, even the digestion starts in the mouth with an enzyme called amylase, turns into glucose. Yes, but we need a little glucose. There are many vegetables that help you with this process. Not only green leaves like arugula and lettuce, but also carrots, radish, eggplant, broccoli, cauliflower. There are lots and lots of vegetables that help you in this process. So don't believe that salad doesn't work, that it's not good for your health, because it is. It's very healthy and will help you. Mistake number 6 is to abuse processed, ultra-processed foods like frozen pizzas, the ones you buy in a box, or frozen hamburgers, those ready-to-eat foods that you buy at the supermarket, and also sausages, because they have preservatives including nitrates and nitrites, which have even been linked to an increased risk of bowel cancer, colorectal cancer. Oh, but I've heard that if I eat some of these foods, I won't develop cancer. There are studies that show that people who ate 3 or more times a week already had an increased risk of developing cancer. If you think about it, 3 times a week is an amount that sometimes you're consuming and don't even realize it. If you eat ham once a week, and then once a week you go out and eat salami, then you're eating an ultra-processed food with nitrate and nitrite. Just look, in a week, doing this 3 times, you're already increasing your risk of cancer. So it's better to avoid this type of food that I mentioned here, okay? Don't fall for the talk that it doesn't harm. There are many people wanting to sell not only the supplements that I talked about in another item, but this is an issue where you need to be very careful, because it's very easy for those who don't care about their diet to eat processed meat or foods that have preservatives like nitrates and nitrites 3 times or more, okay? So avoid these foods whenever possible. Number 5, don't avoid eating fruit because of fructose. Oh, but I've heard that fructose harms the liver, increases the risk of diabetes, and greatly increases blood sugar levels. This is another grand lie. You're seeing that I'm explaining a lot of lies. I'm debunking a lot of misconceptions about diabetes and the pancreas. If this is helpful to you, I'd ask you to like this video. Let's aim for 12,000 likes, because that way the system knows that the video is relevant and will spread this information more widely. So if it's helping you, go ahead and give it a like. And let's continue with the fruit discussion. What's harmful isn't fructose, it's excessive fructose. And many fruits have a reduced sugar load, including fructose, and contain low glycemic index carbohydrates, which don't significantly increase blood sugar levels. Which fruits are these? Guava, strawberry, cherry, orange with pulp. There are several fruits that are good. At the end of this video, I'll talk more about this, continuing with our list. Mistake number 4 is not engaging in physical activity. This greatly harms your health, not just your pancreas. But what's the big question here? If you do 150 minutes of physical exercise per week, this divided into 3 or more times. For example, 50 minutes 3 times a week, besides improving your body composition, increasing muscle mass, and also reducing the amount of fat. Improving your cardiovascular health, for example, the hormone insulin can work better. It can perform its function. What is the function of insulin? Take the sugar from the blood and put it inside the cells, inside the muscles. What happens in type 2 diabetes, which is the most common type of diabetes? You produce insulin. Often you even produce too much insulin. The pancreas does this to try to compensate. But your body is resistant. The hormone can't do its job. And practicing physical activity is a crucial point. One of the most important points for you to reverse this process and have better health and better utilize this blood sugar, you can take better advantage of this insulin production. You can take better advantage of it as a form of energy, all right? So physical activity is fundamental for the health of your pancreas. Number 3, it also harms a lot, just like a sedentary lifestyle, which is obesity. But why is obesity dangerous? What does it have to do with the production of insulin? The higher your fat composition, including visceral fat, the hard fat in your belly, for example, there are studies that have already linked this to increased insulin resistance. That is, the hormone won't be able to perform the function that I explained. So weight control is very important in this aspect. There are studies that took people with insulin resistance and also with diabetes, and a 7% weight reduction already had a very significant improvement in this matter. So weight control is one of the measures as well, another crucial point here. And mistake number 2, which also greatly harms your health, is only getting tested if you have any symptoms. We know that in the vast majority of cases, such as type 2 diabetes, for example, when I say vast majority, I'm referring to 80% of diabetics in the initial phase, right after they develop the disease. They won't have any kind of symptoms, not even fatigue. Look, that's why it's crucial that you get tested periodically. It's not sufficient to get tested only when you're feeling something, because often you don't have any symptoms and you already have high blood sugar levels. Those symptoms, like feeling very thirsty, as a result, you go to the bathroom a lot, the kidneys start to get rid of glucose, the weight loss, that extreme fatigue. You are very hungry. Those symptoms will only occur when the blood sugar levels are very high. In that initial phase, you already have an increased risk of complications like diabetic neuropathy itself or changes in your eyes due to increased blood sugar. And in this instance, you may not feel anything. And the first manifestation, if it's a more severe one, is a complication of diabetes. So, have checkups regularly, visit your doctor. It's not because you're feeling well that you don't have any health issues. This is one of our greatest challenges in treating diabetes, and also keeping not just the pancreas healthy, but overall health. A lot of people assume they only have to go to the doctor or only get tests when they feel something off. Stop doing that. Number 1, and one of the main errors, is to abuse saturated fats. There are numerous videos. There's a lot of misinformation on the internet suggesting that saturated fat isn't harmful. Not only is it harmful and damages the health of your pancreas, but it also increases your risk of having a heart attack or a stroke, for example, cardiovascular risk. So, pork lard is not healthy. Coconut oil is not healthy. It has a high content of saturated fats. Most of it is saturated fats. And there are many who say that the saturated fat in pork lard is not harmful, which is a big lie. What is best for your health? What do you think? Eat an egg with pork lard, fried in pork lard, or eat 2 hard-boiled eggs or 2 steamed eggs or then fried without any kind of fat in a non-stick frying pan. It's much better for you to eat 2 eggs. Just look, you're going to eat more, and not only are you going to improve your nutrition with a higher amount of protein and less fat, but also these 2 eggs here are less caloric than an egg fried in lard. Look at how significant that is. You will not only improve but decrease your risk of cardiovascular disease, and also lower the amount of calories you consume each day. You will eat more and with better quality. There was a study you always ask about the best type of diet. And this study is actually a meta-analysis. What's that? There are multiple studies combined, and this meta-analysis, it's a better kind of study, let's say. So he saw that it was better for you to take care of the total amount of calories than for you to cling to a specific type of diet. When you compare the Mediterranean diet with the same number of calories, or then the ketogenic diet, intermittent fasting, or the high protein diet with high fat, there are several types of diet. The main point here was the amount of calories you can do. So it's better for you to choose a diet that you can adapt to, a balanced diet, and really focus on the amount of calories, because that can indeed make a difference. Besides that, it is much easier for you to do a diet that can adapt. From 0 to 10, what grade do you give this video? If it's 10, I make more videos like this. Also, write here in the comments from which city you're watching this video. I'm talking about Porto Alegre, part of the world that this video has reached. Do you remember I talked about fruits? What are the best fruits? What fruits should diabetics eat? In this video here, I talk about that too. I rate the fruits. I'm sure it's going to be useful and you're going to like it. A hug. See you next time.